I just want to say thank you to everyone for letting me kind of delve into this topic. We're going to go at it from a little bit of a 30,000-foot level. So there's a lot of, if you will, rabbit holes we could go down. But you will hear me refer to this as a wicked problem a lot because we like that term in health security. It explains, really, I'll mention it in a couple of minutes, but a complex issue that is evolving so fast, we're really struggling to keep up. So what is health security? Because that gets thrown around a lot. It's really very obvious thing. It's the protection of health prior and after epidemics and ultimately ensuring community resilience. It's pretty straightforward. But the issue is actually so much larger than that. And it ranges from this full spectrum of biological risks that I'm going to get to talk about today with you. And I do want to mention, these are some heavy topics. So I try to infuse some lightheartedness and humor in time to time because it's, especially right now when there's so much conversation around the COVID origin, these can become very heavy topics that can weigh on all of us. So global health security encompasses that spectrum of biological risks, whether it's intentional, like a bioterrorism event, it is naturally occurring like a pandemic, or it's kind of a whoops, a biosecurity, biosafety failure. But it also looks at everything from antimicrobial resistance to vaccine development, biosurveillance efforts like early warning initiatives, biodefense, which is more the defense application. And we'll talk about that in relations to the Biological Weapons Convention, but also biotech, CRISPR-Cas9, gene editing, synthetic biology, all of these things I'll get more into detail on this, but critical infrastructure is a really big piece, but more and more misinformation and disinformation is becoming a big topic. And I think we can all appreciate that in relation to COVID-19 and the pandemic. But I think the biggest piece is that infectious diseases are really unique in that they're inherently more applicable to impact everything from, regarding critical infrastructure and healthcare to the economy, and their source, especially attribution, is increasingly becoming a topic that will change geopolitics even. So when we talk about these issues, it can feel really easy to ask, how does this really impact me? And I will answer that question throughout this, but really we are seeing that everything that is larger is ultimately coming down and impacting everything from research to how we teach these complex topics. So global health security, this notion that an outbreak anywhere is an outbreak everywhere and disease knows no borders. You see, I have a little asterisk on each of these. And that's because while those statements are inherently true, one thing we've learned from COVID-19 especially, and really even Ebola and SARS-CoV-1, is that an outbreak anywhere, yeah, it can end up everywhere, but some countries are inherently more vulnerable. Some countries are inherently more equipped to handle pandemics and infectious disease threats. And that while a disease itself doesn't know borders, there are borders that impact things. You saw this with COVID-19 with border closures. And while that's kind of like closing the barn after the horse is out, it's really not an effective control mechanism, but it really does change how we discuss the vulnerability we all have to infectious diseases. And that really right now we are seeing a much wider array of biological threats across that entire spectrum than we were 50 years ago. And in this case, a wicked problem is one that we really struggle to address because it's evolving so much faster than policy can manage. And more, this notion of global health security is this intermix of acknowledging that public health and infectious diseases are increasingly becoming a securitized issue. And that changes a lot. So it always begs the question of, is it good? Because if you think about it, when we, in public health, we often have kind of a roller coaster of funding and we're always, begging for more and we see an influx during an event and then the well dries. When you securitize an issue, especially something like public health and global health, that tends to mean the DoD gets involved. We're seeing a lot more infusion of research, but that can change local response. When you suddenly are seeing US military get involved in 2014 and 2016, and in Ebola, that's going to change how local communities engage with public health initiatives. So it's a good thing and it could potentially be a harmful thing. So when we talk about this, it's really reframing the issue. Now, and when I say reframing, I mean infusing security into health. In 1994, there was a UN report that basically acknowledged that when we're talking about security, health ultimately has a big role. And it really wasn't until 2000 when we saw the UN Security Council naming HIV as a threat, as an actual security threat. That's a really big deal. The UN Security Council is saying HIV is a global security threat. And that suddenly means the framing of it really changes. And then in 2014, we also saw another UNFC, so UN Security Council resolution that it said Ebola is this actual security threat. And it expanded how it really applies to this, because if it's impacting international peace and response, and this is especially unique because disease, this was a disease, Ebola, that wasn't traditionally spread through acts of widespread rape or humanitarian violations. So the notion of the UN declaring this through the Security Council really does change how we start to approach infectious disease, and that notion of global health security builds up. So the spectrum of biological threats is really unique. We talk about nuclear and chemical a lot in the world of biodefense, but I always like to remind people that when there's a nuclear event or a chemical weapons event, it's pretty obvious that that is not a natural event. It's quite obvious that that's a man-made thing that we have to start talking about attribution. But biological threats span from intentional to accidental to natural. We're seeing that played out very, very much when it comes to COVID-19 origins. And I think that's kind of the elephant in the room right now, where, and we'll talk about this throughout the presentation, that ultimately an infectious disease doesn't always have an obvious source in a lot of ways, unless it's something like smallpox, which we know has been eradicated. And if it suddenly pops up, it's very likely that was a biological attack. An outbreak can easily be masked as, or I should say an intentional act can easily be masked as a naturally occurring outbreak. So the challenge though with biological threats, and the reason they become so securitized and we've increased that conversation, is they have a lot of attribution points. They can proliferate. There's an incubation period, which is really unique. And there's multiple cases and generations, outside of something like anthrax. But really chemical weapons, it's a very singular event. A biological event, whether that's intentional or natural, can be very far reaching and can last for decades even. So infectious diseases can also mutate, unclear origin, as I mentioned, and they might be novel or well-known. And ultimately, they have a really severe implication for global health, for economies. We've seen this time and time again, especially with COVID-19. I mean, if you think about SARS-CoV-1 in Toronto, the impact to the economy and the tourism alone in Toronto was devastating. So really, I think the big piece is that biological threats are vastly unique. And when we talk about them, especially in the security realm, which often likes to take over and only think about bioterrorism, the truth is that we need to invest in all response mechanisms, whether it's just your local public health department, your infection control within a healthcare, or vaccine and medical counter development. So I'm going to start with natural biothreats, but I'm not going to spend too much time on this because I think we're all very acutely aware of this. But natural outbreaks, everything from SARS to Ebola, they're unpredictable. I think the issue is that each outbreak is very, very unique, but increasingly we're seeing zoonosis and spillover pose a really big and consistent trend. If you consider that 70% of emerging infectious diseases are zoonotic and of animal origin, that raises a really big flag. The topic that I don't think gets discussed enough in global health security, and unfortunately Dr. Harris has heard me complain about this time and time again, is antimicrobial resistance. We jokingly say it's not a particularly sexy topic, but it's a really impacting one that the world of health security tends to neglect, but is increasingly having to discuss. But also, when I mentioned that every outbreak is a little different, we saw from Ebola that everything from case fatality to the R0 changes. Same with each variant within within COVID. But the issue with natural biothreats is that the response mechanisms consistently lack on a good day. Infection control and public health are underutilized, and we're often seen as a cost center and not a revenue generator. So the challenge is that you have inconsistent funding, but when you talk to someone in the DoD potentially about biological threats, they'll say, well, the best defense is denial. So if we deny a potential non-state actor the potential for a biological weapon to impact us, then they're not going to want to build one. Well, where do you think that comes from? Your preparedness for an infectious disease threat is your core public health and your medical countermeasure development and your infection control. So it's kind of this hysterical juxtaposition when we talk about global health security, because it tends to always lean more in the security aspect, but it's the health aspect that's really the foundation for it. So response around a novel pathogen can be really complex. First of all, we have a lot of transmission dynamics that are constantly going to be changing. We saw this play out in real time with COVID-19. What percentage is aerosol versus droplet and fomites? Oh my gosh, the amount of bleach and barriers we're still seeing. But there's nuance. When we handle a new disease from a public perspective, There's so much challenge and nuance in terms of communicating spread and risk and intervention is extremely challenging. And one thing we consistently see is that you have to really engage your community and tailor your messaging to the needs of the public. So misinformation is increasingly becoming a problem. You know, we jokingly talk a lot about armchair epidemiologists during COVID-19 because suddenly everybody became an expert. But the issue with that, and especially with social media, is that it can widely spread misinformation in a way that you're now having your experts having to spend time correcting. And in real time, people are seeing this information played out, these very academic debates played out. And that can really, lose public trust in science and public health response. And in general, just how we approach these complex problems. So it's a marathon and not a sprint, but right now this focus on origin is easily becoming politicized. And really, this is a bigger thing that speaks to our approach to infectious diseases and outbreaks. We talk about the WHO's SAGO, which is a group that's really about trying to understand the source and origin of novel infectious diseases. That is a critical part to how we handle novel pathogens and outbreaks moving forward. And it's only going to become that much more because geopolitical issues really are starting to impact our response to infectious diseases. So I mentioned geopolitics, hubris, but the truth is that wealth doesn't always equate to capabilities and capacity. The Global Health Security Index was something that came out very late in 2019. And it's a really, really wonderful document. It really breaks down all of the things that, it's essentially measuring country readiness for an infectious disease threat. And this is a really important topic to address. And they're really starting to break down all the avenues, whether it is your public health infrastructure, your laboratory reporting system, even healthcare readiness. But the issue is that, we equate readiness in these kinds of documents with readiness in the real world. And the truth is that the US was ranked in the top within the Global Health Security Index. And this was released right before COVID-19. As we can appreciate, this really wasn't the true reality. So I'm going to include this quote from Ed Young, who has been a really wonderful science journalist from The Atlantic on COVID-19, because I think it's a really important piece when we talk about global readiness and infectious disease response. So COVID-19 will neither be the last pandemic nor the worst. Its lessons will dictate how well the US prepares for the next one. And the country should start with its understanding of what preparedness actually means. In 2019, the Global Health Security Index used 85 indicators to assess how ready every country was for a pandemic. The US had the highest score of all 195 nations, a verdict that seemed laughable just 1 year later. Indeed, 6 months into this pandemic, the index's score had almost no correlation with countries' actual death rates. If anything, it seems to have indexed hubris more than preparedness. And I think that's a really critical point, because when we talk about global health security and infectious disease preparedness, we often equate a country's wealth and with capacity and readiness, and that we assume that we'll be able to handle it. So next, I want to delve into a hot topic, which is accidental biothreats. I call them bioerror, not bioterror. And biosecurity is really the name of the game. So this is a really complex topic, and I apologize that this is at a 30,000-foot level, but I want to break it down very, very kind of surface level. So biosafety is when we're protecting people from the germs. We've had some failures like finding smallpox in NIH freezers, DoD shipping live anthrax. And then we have biosecurity, which is increasingly becoming a little bit more of an opaque and larger term, but that's when we protect the germs from people. So think about the Amerithrax attacks or intentional theft. And now we're getting into DIRC and GOF, or gain of function. So there's a lot of acronyms I'm throwing around, but dual use research of concern is what we refer to as DIRC. And this is a really large umbrella which definition is actually slowly in the process of changing a bit, but it's basically life sciences research that, with the current understanding we have, has reasonable anticipation to provide knowledge, information, products, or technologies that could be directly misapplied to pose a significant threat, meaning this is helpful research, but it could be misused very easily. And then you're hearing a lot about gain of function, or GOF. So this is the genetic manipulation of pathogens that could potentially introduce a new function. And I think it's really, really important to note that what you are hearing right now in terms of COVID and gain of function research is gain of function research with potential pandemic pathogens, or P3. And that's meaning we're enhancing pathogens that have a pandemic potential. That's not everything. That is very specific to MERS, Ebola, SARS-CoV-2, those kinds of things. So gain of function research itself doesn't mean anything inherently bad. It doesn't mean it's working with a dangerous organism. It's just really trying to change the functionality of the organism and testing for various reasons. So I think it's just important to differentiate that not all gain of function involves pandemic potential pathogens. So here's the thing. When we talk about bioerror and not bioterrorism, biotechnology and dual use research is considered itself a wicked problem. It's resistant to long last change. CRISPR-Cas9, gene editing, synthetic biology, all of that stuff you've been hearing a lot about. You know, us modifying mosquitoes to address Zika virus is a great example, but also the garage DIY community, meaning people are starting to modify organisms in their garage because you can buy CRISPR kits online. So here's the reality of this. This is an amazing field of science, but we are starting to see some concerns with some of the research that's done and the biosecurity around it. So some examples of research that's actually triggered some security concerns. There was an H5N1, meaning highly pathogenic avian influenza study that was looking at transmission between ferrets. And they basically genetically modified it to spread faster or more efficiently between the mammals. And they found that it worked, and it was able to really be spread between ferrets, which is kind of a model for human transmission. So that was a big concern. So that was the first triggering event. There was a 2001 Australian research team that was really trying to alter infertility in mice using a mousepox strain, and they accidentally created a mousepox strain that was resistant to vaccination efforts. So that created a big heads up, like, oh, mousepox is really close to smallpox. We don't like that. And the joke about this one is that there was a biodefense security individual at a conference who happened to walk by the research team presenting their poster, stopped mid-walk and just looked at it and hit the panic button, because this is really important and really interesting research. But it was basically the concern for some of this is that it's quote unquote creating a cookbook for people with nefarious intent to take these, these tools and these strategies to misuse for building a biological weapon. So next we have all the acronyms, and you're going to see a little C3PO in here. So as a result of gain of function research and dual use research of concern and all of the, the building anticipation around, all right, this is important work, but what is the risk it's going to be misused? And what is the risk that it could potentially come out of the lab accidentally? And if we're enhancing these pandemic pathogens, is there potential that there could be a biosafety failure or a biosecurity failure? So there was a moratorium, a pause on federal funding, and this was really voluntary in 2012. And then there was a larger one in 2014 on federal funded projects. And this was to say, all right, let's take a beat, let's take a moment and evaluate biosecurity and biosafety initiatives. How are we approaching these projects where we're taking things like HPAI, SARS, and MERS, and keep in mind this is SARS-CoV-1, and we're enhancing them potentially. Are we asking the right questions? These facilities have the necessary tools in place to keep us safe. So NSAB was created, and that's the National Science Advisory Board for Biosecurity. So it's a federal advisory group that comes together and creates a set of recommendations and criteria for us to do science safely. Now you see this in here, it's highlighted federally funded. And I think that's a really important point, because the moratorium was on a very specific number of viruses and a very specific group of researchers. Now, if you are a private research institute, this moratorium did not impact you, only if you were getting federal funding, which is a lot. But nonetheless, I think that's a really interesting challenge we're facing when we're talking about some of the more risky research, that if it's done in a private lab, then there's not a lot of oversight actually. So in January 2017, they released P3CO, which we jokingly always call 3CPO. So that's why I have our little Star Wars reference here, which is the Potential Pandemic Pathogen Care and Oversight. And this was a nice way of saying, hey, if you get federal money for this kind of research, we want to make sure you have certain protocols in place, that there are questions being asked in the architecture phase and the design phase of this research, so that you're not getting all the way downstream and then suddenly saying, wow, maybe we shouldn't be doing this, or maybe we don't have the necessary tools in place in our labs to safely do it. So in December 2017, there were new rules released by the Department of Health and Human Services regarding gain of function research involving pathogens of pandemic potential, or P3. We love acronyms. And dual use research of concern, essentially. So some of these proposals included everything from modifying the design or conduct of the project to what would be published publicly. That's always a big question of, well, this is important research, but if we publish it, is it going to pose a risk? So more recently, actually, NSAB updated their guidance to reflect some of the bigger questions that we've been learning through the COVID-19 pandemic. So there was also the Canadian horsepox incident, and this was a research. So you'll see in here, this little comic I always find funny because that's often what people think of the researchers, that they're inadvertently just careless, and that's really not the case. The researchers doing this work, they don't want to get sick either, and they definitely don't want to lose the capacity to do this research. But there was a Canadian horsepox synthesis kind of experiment that was done a few years ago where they took $100,000 small team in a few months and were able to buy genes online and basically reconstitute horsepox, which was a big concern. Anything that's an orthopox we worry about for smallpox, right? So if it was a small group of individuals that could do this with only $100,000, what does that say about larger capacity for non-state actors to take that technology and those lessons and build a biological weapon? So this, the research of gain of function with enhanced pathogens is a big one right now. It's a hot topic. That's why I'm spending some extra time talking about it, because it's exceedingly complex. And there is this biorisk spectrum where there's a potential for misuse, but overwhelmingly, we're finding that the conversations really are much larger, much more complex than just, something that we can discuss in a few minutes, require larger groups, but also those doing the research. So next, we're getting into that, the other side of the spectrum, which are intentional biological threats, meaning bioterrorism. And I think it's important just to kind of overview this because many people don't know that we've actually had an active bio program we did prior to the Biological Weapons Convention. And the reason I bring this up so much in public health is because in 1984, there was a salmonella attack by the Rajanshi cult. And we actually didn't know that this was a biological attack until years later when one of the members was caught for something totally non-related and admitted it and then shared proof of it. So things like that are a big red flag because so much of that securitization of health issues I mentioned really focuses on bioterrorism. But the crux of it is that if you don't invest in that core public health infrastructure, we're not going to be able to respond either way. So intent doesn't always change how we manage something. And of course, Shinrikyo, this was a terrorist group that actually attempted to build biologic weapons out of Ebola even. So those are the non-state actors, meaning the people that are, small groups or individuals. And technically the Amerithrax attacks are considered biocrimes. But the state-sponsored ones are the ones that are actually particularly worrisome. The good news, though, is that we do have a biological weapons treaty in place, which I'll mention in the next slide. But I like sharing this because I don't think people realize that prior to that, the US, the UK, France, Japan, Canada all had active biological weapons programs and sunk a lot of money into it. But the truth is that even Russia, which had probably the largest program, still struggled with the sheer reality of building a biological weapon. And it actually continued far longer than we would have liked them to. South Africa had Project Host, and this one was actually very specific in that its goal was to attack certain groups of individuals. So they were really looking at the genetics of disease. But I also want to include the recent allegations by Russia regarding the US and Ukraine. And the reason why this is important, and I bring it up especially in the context of health and public health, is that Russia made these allegations early 2022, right when they were starting to invade Ukraine, as a misinformation campaign. And they were alleging that the US was assisting Ukraine in an active biological weapons program, which is categorically false. They were referring to some of our work where we actually help countries build up their lab biosecurity and biosafety efforts, meaning we want to make sure you're doing great research, let us help you make sure it's secure and safe. So they took that and ran with the misinformation campaign, went to the UNSC. This actually became a big issue at the latest biological weapons convention, which is the treaty when we had the review conference in December, and it was a huge, huge issue. And so the reason that this is important for us is because when those allegations are made, even though we know the intent behind them isn't legitimate and that it's been found to be false, it really starts to put into question that research and that work that's being done and can have larger implications for how we're lowering the norms, not only for biological weapons, but also that we might not want to fund some of this research if countries are going to use it as a way to drive misinformation campaigns. And that's really concerning. That's really scary. So our response to this was the Biological Weapons Convention. And I'm not going to spend too much time on this, but I think it is important because this was really the first multilateral treaty to outlaw an entire class of weapons. And it's really complicated. Watching the debates around science and technology of it is really fascinating to me because this is about not stockpiling, not developing biological weapons. And really the challenge is how do we measure biodefense versus an offensive program, right? It's all about intent, and that can be increasingly hard to identify, especially in an era of, not always transparency. So this was our response to biological weapons, and it is really important, but it's nonetheless an incredibly challenging one, if I'm being honest. So we have to acknowledge, though, the reality of a wicked problem. And that's first and foremost some of these little opportunities we've had. So I'm going to go through them. That's the Global Health Security Agenda. This is a really wonderful kind of attempt that was really developed as a response to Ebola in 2014 under President Obama. And the goal of it was acknowledging one country's response to an infectious disease is going to impact all of us. So the way the GHSA works is that there's a whole list of essentially topics that can either increase or decrease a country's readiness to infectious diseases. And one thing I love about this is that it actually includes infection prevention. Not a lot of these things do. So the GHSA will actually, it has a variety of countries, and they have what's called the Joint External Evaluation. And this is a really cool way that a country can invite the GHSA in and say, hey, can you assess our readiness? And there's a checklist. And it's not just that they'll identify vulnerabilities, but they'll actually provide them opportunities for improvement and ways to move forward. So this is a really nice approach and kind of a non-punitive, almost a just culture acknowledgement of there are vulnerabilities and we want to help everyone. So there's an increasing focus also on biosurveillance that we're seeing. The CDC just recently developed the Center for Forecasting Outbreak Analytics, really acknowledging the data gaps that we have that COVID-19 shed a huge light on. And it's not just data gaps, but also how are we using these in a forecasting perspective? So this is, their goals, I think, are still being developed, and it's a really, really wonderful team, but they're still kind of, I think, finding their footing in terms of what are we going to achieve and what's our 2023 long-term plan, essentially. So we also have the international health regulations, which you've probably heard of. This is the IHR, and this is a larger framework. Think global, think WHO. And this we really saw come into play when SARS-CoV-1 happened in 2002. So in 2002 with SARS-CoV-1, there wasn't a lot of transparency from China initially, and there was a bit of a delay in sharing of information when SARS-CoV-1 was starting to bubble out of control. So the IHR really comes in and says, all right, it is an obligation that every country has to let us know when there's an outbreak occurring, assist in response. And there's also the declaration of a public health emergency of international concern. So think of the IHR as a larger initiative, not only for accountability, but also support. And it's a really, really important process and program that's increasingly being updated. But that is where you'll see the FIKE declaration, that public health emergency of international concern declaration, come through. So the WHO is heavily involved in this. The Biological Weapons Convention, I always like to say remind people it's a treaty. A convention sounds like we're all getting together to talk about biological weapons. And while that's technically true, it's not a fun convention. It's a treaty where a bunch of countries argue about things. So nonetheless, though, it is a really important multilateral disarmament approach. The sad thing that I'm starting to see, and we experienced this in Geneva in December, is that unfortunately, geopolitics is increasingly playing a larger role in progress, and that we really are struggling to address science and technology and how everything like gain of function, like synthetic biology, is impacting the capacity for countries to verify that they don't have malintent. So addressing the bioeconomy is a big piece too. The bioeconomy is a much larger issue. I mentioned synthetic biology before, but we're also seeing AI integration. And there's a lot of conversation surrounding how can we secure the bioeconomy, but also ensure that it's not spiraling out of control in terms of biodefense efforts. Again, that's a whole different rabbit hole we could go down. The National Science Advisory Board for Biosecurity I mentioned is a huge, huge initiative. The problem, though, is that increasingly these are recommendations, and you're going to see this time and time again, that there's, outside of the Biological Weapons Convention and the international health regulations, there's not a lot of enforcement of some of this stuff. And that can make ensuring oversight and that people are doing the right thing really hard. So I mentioned SAGO before. That's the Scientific Advisory Group for Origins of Novel Pathogens. That is developed by the WHO and was increasingly really focused on attribution, but there's been some concerns that it's kind of falling apart a little bit, or what that looks like. And the reason I mentioned SAGO is because initially the goal was to go in and work with China to understand an origin for SARS-CoV-2, but with the politicization around that and the geopolitics that are now in play, that's really not happening. So all of these things are intrinsically very, very connected, and that, some of these being very, very macro, but on a micro level, they truly do impact our capacity to respond on a national level, the money we get for response, but also the science that's currently happening. So why does this all matter? We're increasingly in an interconnected world. Growing incidents of outbreaks, we've got Marburg and Equatorial Guinea, we've got H5N1 all over the place, and mammals, deeply concerning what we're seeing in Spain with the minks, and of course the 2 human cases in Cambodia. Now, I saw recently today that there are some concerns for a human case in China. We're seeing a lot of spillover events. In fact, some of that politicization and securitization I mentioned, just prior to this, we were on calls about what virus hunting looks like. When we're doing virus discovery out in the wild, sampling bats, is that increasing the risk for spillover? So securitization isn't also really happening when it comes to science and response, but also now more so infectious disease preparedness. And the reality is that preparedness and our response to these IDs are becoming more politicized, and they're very much impacted by geopolitics. So when we're looking at capacity building and development from non-pharmaceutical interventions, or NPIs, to vaccines, we have to acknowledge the reality of what's happening right now, and that so many of these issues, even, Operation Warp Speed, which helped identify and create a vaccine for COVID-19, was heavily securitized and involved the DoD. So these are all very, very connected. And the issue is that, when we say security and public health, I think naturally it makes us flinch a little bit, but this is the reality of the world we live in. And when you're including the politics of it, we have to kind of know what's happening so that we can also help correct that misinformation, so that we can teach people that, this research might be risky, or how do we frame it to get people to understand why it's important. So here are some of the questions that really speak to the challenges that we're facing. So first and foremost, should viral discovery happen? Meaning, this is a nicer term than virus hunting. I think a lot of the virologists that do it and that go into the field don't like virus hunting because it sounds like you're kind of trophy hunting. But should it keep occurring? That's been a huge topic since COVID-19, because of course there are concerns. We're actively going out looking for viruses. We all have a personal opinion on it. There's a lot of merit to it. The EcoHealth Alliance was heavily engaged in this, but more so it's raising the question of, is it increasing the risk of spillover? In the quest to find these novel pathogens and get ahead of them, are we increasing the risk for them to spill over into those doing the science? So a good friend of mine is going to Nigeria on a project where they're actually looking at bats and the host response that they have in relation to really kind of human encroachment. So they're sampling bats to see if stressors from humans are impacting their microbiome, their capacity to carry certain viruses. That is really important work, but you have to do it safely. And if you're not doing it safely, then it really runs the risk of not only ecological impact, but also biological and spillover events. So next, the question is, do we need more regulations for gain of function work involving those pandemic pathogen or potential pandemic pathogen studies? Whew, that one is, we could spend weeks talking about that. And unfortunately, you're seeing it play out in real time because COVID-19 and so much concern around lab release. So then the question is, who's also responsible for origin investigations? Right now, the US is heavily focused on that, but should that be a single country? Should that be a global effort? And when should that start? What does that look like? Those also are very much going to impact how we frame COVID, how we frame response. but also our engagement with our international partners, which can impact science as well. So where should we put resources from pandemic response? I think we could all probably say something a little different. We all are very opinionated about that. But nonetheless, now that the money is kind of starting to drain out a little bit when it comes to pandemic response, where do we invest our resources? What's going to make the biggest difference? The US has a really bad habit of learning, taking the lessons historically and applying them to the future. And unfortunately, that doesn't always translate to us really learning the lessons from the past. Each biological event is different. And I think COVID-19 shed a lot of light on that in terms of what we had been investing in and if that actually helped us. So I also say, how do we address misinformation regarding vaccines? I think that's something everyone in this room has dealt with, and it's increasingly challenging. Also, even for masks with the Cochrane Review, how do we communicate very nuanced science to the public? There was an effort by the CDC, I think, in some ways to really make it easier for the public to understand, but sometimes when we almost dumb it down so much, we create very binary thinking. And unfortunately, that can negatively impact the nuance of it, the complexities of it. So everything from masking to misinformation around vaccines needs to really fundamentally be addressed. And then also supply chain. How have we fixed it? Do we have a better supply chain if we have another pandemic? What if it's not necessarily masks again? These things are really, really big. I've not seen enough conversation around the supply chain. I think we're still quite vulnerable, if I'm being honest. But one of the questions I want to ask you, this is probably one of my favorite ones, when I'm talking to such a wonderful group of folks who maybe haven't done work in health security or gotten to dabble in the world of the biological weapons convention, is Captain America a biological weapon? Would he violate the Biological Weapons Convention? So I'm going to read you this piece, so I want you to think on it. Each state party within this convention will agree to never in any circumstances, develop, produce, or stockpile or otherwise acquire or retain microbial or other biological agents or toxins, whatever their origin or method of production, of types and in quantities that have no justification for prophylactic, protective, or peaceful purposes, but also weapons, equipment, or means of delivery designed to use such agents or toxins for hostile purposes and armed conflict. So this is not something we'll delve into now, but it's a question that I think really kind of takes our knowledge of science and intent and conflict and treaties and politics, and is kind of a fun one to run with. So this is how inherently complex the world of global health security is, but that it really trickles into everything we do. So I just want to take a moment to say thank you all for listening. And of course, wash your hands. We got to prevent the next zombie apocalypse. But I'm going to turn it over to Dr. Harris and anyone for any questions. Thank you.
Thanks very much, Dr. Popescu. Great talk. Very interesting.